Israeli military attacks on Gaza have killed more than 100 Palestinians across the Strip on Sunday. One of them hit a camp sheltering displaced people in al-Mawasi in southern Gaza. That's an Israeli-designated safe zone. 36 people died there. Many more were injured as their tents caught fire. They've been taken to nearby hospitals. Dr. Victoria Rose is a consultant plastic surgeon at Nasser Hospital. She's joining us live from Khan Yunis. Thank you very much for your time, Dr. Rose. We really appreciate it. I understand that you've returned to Gaza this week after working at Nasser and also European hospitals last year. How would you describe the conditions in the Strip compared to your time last year?
The conditions are very different from when we visited last year, both in the medical supplies that we have, but also in the state of the population. When we drove in, the state of the landscape hadn't changed hugely, but we were last here in August, and by that stage, I think most of the buildings had already been flattened. So we were driving past the same piles of rubble that we'd driven past before. But the real difference when we came to Nasser was the lack of supplies. We haven't had any medical or food aid into the country now for 76 days. So we are relying on NGOs trading their surpluses with each other. And to the extent that we sent a team back to the European Gaza Hospital, which was bombed earlier this week, yesterday, to see if they could scavenge any of our instruments and medical supplies. It's really dire, and we're running out of basically everything that we had.
Yeah, when you say that you're relying on... Sorry to interrupt, I just wanted to pick up on something you said. You said you're relying on NGOs sharing their surpluses, but given it's been more than 2 months of a complete blockade, including on all medical supplies, are there many NGOs that have much of a surplus anymore?
Some NGOs have a little bit more of some items than others, and so there's some trading going on for what you've got a little bit more of, so that you can get something that you've got nothing of. But it really is sort of small level bartering just to keep us going for a little bit longer.
And what does that mean for the type of care that you and your colleagues are able to provide, especially given, you're a plastic surgeon and we have seen such an increase in Israeli attacks. Just this morning, again, we are seeing a lot of burn victims from tents being set on fire in the attacks.
Well, it's not the specialist supplies. I mean, irrespective of that, it's the basics. It's the basics that we don't have. We're unable here to run any blood analysis, so we can't do a full blood count. We can't look at the urea and electrolytes and the kidney function. We're really limited on blood. We had a young girl yesterday that came in. She'd been run over by a truck. She had quite significant injuries, and she passed away later that evening of overwhelming sepsis. Now, that child would have survived in the UK because we would have had the facilities on our paediatric intensive care unit to support her systemically. We don't have any of that here. This is unnecessary deaths of children.
And how difficult is it for you? It's been more than 18 months of this war now to see children dying from things that can be treated. It gets harder every time you lose a child. It's not something that you get used to. It makes you very angry that this is still going on. But at the same time, I'm very pleased that we're here to stand with our Palestinian colleagues because they've seen so much more of it than I have. And it's clear, the reception that we got when we arrived, how much our support means to them and how much it keeps them going. You've already mentioned that it's not just a lack of medical supplies for the very specialist care that you're able to provide, that you could provide if you had the equipment, but you're not able to provide the most basic of care because of the lack of medical supplies. But what about things like we have seen, UN-backed reports about the starvation of people in Gaza now? What impact is the fact that people don't have access to food, clean water? What is that having on patients' health, both on children and adults?
Well, it's hitting the children a lot harder, and you can see that in the population as you walk through the streets. The children are all
underweight, they're very small, they're very cachectic. The adults have coped slightly better, but all of my colleagues that I know that were here with me in August all look a lot thinner than they did when I last saw them. The real issue is the ability of the body to heal. So with a lack of certain vitamins and minerals and sustained nutrition, you can't heal these sorts of wounds. You're also far more susceptible to infection. And that's the problem that we're seeing. We are bringing people back day after day with unhealed wounds and advancing infections. And life-threatening sepsis is what is killing the patients at the moment.
Dr. Victoria Rose, thank you so much for joining us to give us a better picture of the conditions there, especially in hospitals. We really appreciate it.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.